Hello everyone, welcome back to another video. My name is Rachel and I am an orthodontic assistant, and I have been an orthodontic assistant for going on 3 years now. All my videos are fitness, orthodontics assisting, and just life, so like vlogs and all that. Go ahead and hit that subscribe button for more videos in the future. Please give this a like and comment down below what you would like to see next. Not only am I a orthodontic assistant, I am a fitness coach, so if you want to get in contact with me about that, follow my Instagram, DM me, and we can get started. I do have a Black Friday sale either posted now or it's coming up depending on when I upload this. So hashtag reps with Rachel. Excuse my appearance today. I have no makeup on at all because I just did like a super in-depth facial, and I'm not about to put makeup on to strip my face from like washing it so much and putting makeup remover on. I feel so weird doing this with no makeup, but I gotta get this video done because I'm going out of town. Okay, for today's video, as you can tell, it is all about spacers, what they are, what they do, what they feel like, everything you need to know about spacers. So I came up with 11 common questions that I get as an orthodontic assistant about spacers. And stay tuned because at the end of the video, I'm going to show you what the spacers look like, what the tool looks like that we use it for, how to use the tool, and how we put them in, and I'll show you like me actually putting the spacer in between teeth on my cousin. So stay tuned for that. That's going to be at the end of the video. I'm going to go over all the questions. So let's dive in. So the first question is, what are spacers and what kinds do we have? So they are little blue rubber bands, at least ours are blue. We also call them donuts, and we floss them in between your teeth, usually like the back molars, because sometimes they're crowded and we need room back there to fit bands around your tooth to get started with braces, because we fit bands on your very back molars because that's like the anchor for your braces. We need those to keep the wire in place because, you know, there's a wire in braces. We need a band, you know, for the wire to stay in place, but to put the band on, we have to have room around your tooth to fit a band on your tooth, like literally like a ring around your tooth that we put on your tooth. And we need room because if your teeth are like, if one is trapped under one, like that, they're really tight contact, like they're just really, really tight, we need to put a spacer in between so that way we can fit the band around and get started with braces. At my office, we also use brass spacers, so if we cannot get blue spacers in because the contact is just way too tight, which happens quite often, we use brass. And I'm gonna try to find a picture and show you what it looks like. And they don't hurt either. They're just, you just kind of have to thread them through the contact almost instead of flossing them, because you'll go through a lot of blue spacers, like you'll break them a lot when you're trying to get through a really, really tight contact and you need to use brass. So that's when you're like, okay, I need to use brass, when you keep breaking spacers and you can't get through the contact. And then I'm just gonna quickly mention, we also have a TP separator, which I don't see very often, but my one doctor tends to use them a lot. They kind of look like a mini paperclip. The doctor uses a math how to click it in, and it makes like a weird noise. And that, I think that one, it just stays in between your contacts a little longer. Like, and I'll get into how long you gotta have spacers, but for the TP, like you can have for a long time, or like a longer time than blue spacers, or like rubber spacers and brass spacers. Second question is, what are spacers used for? And I kind of just explained, but we also use them for palate expanders. So when a child or a patient needs to get a palate expander, we have to put spacers in between by the 6s and by the 4s, so by the bicuspids, the 4, and the molar, the 6s. That's where we fit the bands. Personally, like our office, that's how we fit our bands for the palate expander. So yeah, molar bands and palate expanders is what we mainly use spacers for. To fit a palate expander, we need to fit 4 bands. So we need to put spacers in to be able to fit around the tooth. We also use rubber spacers if there's like, if the 7 molar is caught under the 6, we will put a spacer back there just so it'll give it room to kind of like not be on top of each other. So that's another thing. Third question is, how many spacers will I get? And that just depends on the person completely. I wrote down kind of a general idea. So if you're getting a palate expander, expect to get between 3 and 8. That depends on how many teeth you have. And if you have space between your teeth already, because if you have space already, like the spacer won't stay in. You know, there's no need for it. Usually molars are pretty tight and you're guaranteed to get some back there, but like for the palate expander, sometimes people have space between their bicuspids and you don't really need to put a spacer. So for molar bands, for one arch, you can expect to have 2 to 4 spacers. And again, that just depends if there's a lot of space or if you're like missing teeth. So yeah, molar bands on both arches, you can expect to have 4 to 8. So we don't usually give more than 8. 8 is usually our max. Fourth question, are spacers always necessary? And kind of like I just talked about, it depends on the person, how much space you have, how many teeth you have, and just mainly the space, because spacers are for creating space. If you already have space, you might not need them. You know, we have room to work. But most people need spacers, I would say. Question number 5, how long do they stay in for? At our office, they usually stay in for about 2 to 3 weeks, probably 1 to 3 weeks. We usually don't go like 5 to 6, just because it doesn't take that long for space to start. And, you know, they're going to fall out and we don't want them to be away from us and just for the space to close, and then they have to come in and get a new spacer, you know. So 2 to 3 weeks is like a good middle ground, I'd say. Question number 6, how do you put spacers in and how do you take them out? So at the end of this video, I'm going to show you how we put them in, but you pretty much just floss them in. I know some offices actually use floss to like floss them in. I've talked to other assistants where they do that. But we, at my office, use a tool that is made specifically to put spacers in. So you'll see that at the end, what that looks like. To take out spacers, we just take a scaler or an explorer and we just pop them out. We just get in a little circle, or the lumum, or the, what is the, I cannot think of the term of like the circle of like the middle of the spacer, or like the little colored bands, like there's a name, a lumen. I want to say it's a lumen. Like there's actually a name for like the circle. Like here's the band, like the circle of it, the lumen. I want to say that's the word. Anyways, I'm getting off topic. So yeah, we just use a scaler. Super easy, doesn't hurt when they come out. Question number 7, what does it feel like? So when we put spacers in, it just feels like floss. That's what I tell every patient. I say, I'm going to put some spacers in. It's going to kind of feel like floss. You'll feel me by your gums, but it shouldn't hurt. And then a lot of patients say that it feels like there's something stuck in their teeth, obviously, because there is. I'm going to be honest, it is annoying. I've had spacers. It just feels like there's a piece of meat or something in between your teeth, and it's just really annoying for the first couple of days. Question number 8, do they hurt after? Every person is going to have a different answer to this. Personally, I thought they did. A lot of patients think that they do, and it's not so much like a hurt, it's more like a achy, sore muscle type of pain. It's just like your teeth are literally moving. You know, we got to space out your teeth, so this is like the initial movement, you know, even before braces. So you're probably going to feel something, and that's very normal. Some people don't feel anything at all, so that's good for them, but everyone is so completely different. Like I said, I hated my spacers. I was very sore, but you can take Advil, Aleve, ibuprofen, whatever your mother or caretaker wants to give you. I'm not gonna tell you what, like how much to take, but that's what we tell our patients for the pain. Not just for spacers, but we tell the same thing when they get braces as well. But always ask your orthodontist or dentist and your mother and your father what you should take before you take anything after watching this video. Yeah, so disclaimer. Question number 9, how do I eat? Just eat normal, but the only thing is you cannot eat anything hard, sticky, chewy. So no gum, no Laffy Taffy, no Sour Patch Kids, no suckers, no anything like that. Just be very careful with what you're eating and you should be fine. Just, you know, candy's not good. It's just gonna stick to the rubber band or your spacer and pull it right out. You don't want that because you're gonna have to go back and get a new one probably. So watch what you eat. Be careful. And you might as well just stay away from hard, sticky, chewy things because when you get your braces, we're gonna keep telling you to stay away from hard, sticky, chewy things. Question number 10, can I brush and floss? Yes, you can brush, just brush normally, how you would. Can you floss? Yes, but only the teeth without any spacers in between them. So floss like your front teeth. Don't floss where the spacers are because obviously you'll just floss them right out and you don't want to have to go back and get another one, so just don't floss around there. Just brush normally and you should be fine. You want to keep them clean back there, so yeah. Question number 11, what if a spacer happens to fall out? And as long as you're not picking at it, like messing with it, or you're not eating anything hard, sticky, chewy, and you're doing everything right, you should be fine. That just means there is enough space for your doctors or assistants to work around, so that's fine. But if you're messing with it and you're not listening to directions, you probably should go back and get a new one, because if you're just sitting doing homework and one just like falls out and you feel it on your tongue, you're like, oh, how did this happen? You're fine, and you probably just have enough space, and you're probably going to go to the orthodontist in like a week from then or something, and that's okay. But call your orthodontist or doctor just to make sure if you are still worried about it. We just kind of say it's fine. But yeah, like I said, if you are picking at it and just eating the wrong things, sticky, hard, chewy things, you're going to have to go back and get a new one because, yeah. Unless it's like really close to your appointment, then I'm sure you're probably fine. But just stay away from hard, sticky, chewy things and your life will be much easier. Well, that is the top 11 questions, or 11 questions about spacers. So now I will insert the clip of me putting in spacers. And yeah, so I hope you guys enjoy that or find it helpful. So this is what spacers look like. They look like little rubber bands, little blue rubber bands, or we call them donuts. And this is the plier for them, and I'll show you how to get them on. So I'm just going to I washed my hands. I'm going to take one out. I'm going to put 2 in my cousin right now, but hold it like this. At least this is how I hold it. And then that's how you open it. And then you close it like that. You're going to go like this, open it a little bit, and there you go. And that's how you hold it. Now I'm going to put one in my cousin. They look disgusting, like it really just got out. Where's my gloves? I just got off work and I literally look like a mess, so I'm sorry that I look like this. But I am going to glove up since we're doing orthodontics at home. Alright, so I'm going to show you how to put a spacer in. I'm going to put the spacer in between her 6 and 7 tooth. So her last molar back there. Because she does not have wisdom teeth yet. So I'm going to hold it. The pliers, I'm going to hold it. When I'm in the lower, I'm going to hold these facing up instead of this way, because if it snaps, it might get her gums. Here, like that. So when I'm in the upper, I want to do it that way, because if I do it that way, if it snaps, it's going to go up towards her gums. Alright, so go ahead and bite down a little bit. Turn this way a little bit. Alright, so I'm going to take her ties off. I don't know, let's see. Alright. Put your chin down a little bit. Got that. Now I'm going to take her wire out. Not completely because it's tied in the front, but I'm going to take it out of the 7th so I can get her separator in through the contact back there. I'm just going to take it out. Now I'll try your separator. Go ahead and open real wide. Yep, just like that. Nice. got it through the contact. It is in. I don't know if you can see it way back there, but right there. All right. Just messed up, like bent. All right, you can stop. Thank you guys so much for watching. I hope this helped. If it did, please give me a thumbs up. Please subscribe. I'm trying to get to 1,000 subscribers by the end of this year, which I'm not sure if it's going to happen, but if you could help me get there or at least close, I would highly, highly, highly appreciate it. So go ahead and hit that, and let me know what you guys want to see, and I will see you guys in the next video. All right, bye.